FaceRehab podcast series.
Welcome to FaceRehab, the facial palsy road to recovery. I'm your host, Veronica, and I'm excited to introduce our guest, Dr. Ivana Virvova, an ENT doctor, facial specialist from Vienna, with extensive experience in diagnosing and treating patients with facial palsy. In today's episode, we'll be discussing an important topic, ear pain, and its connection to facial palsy. We'll explore the typical causes, what clinical examination involves, and how ear pain is typically treated. With Dr. Ivana, we'll also share practical tips, and with her expertise, we are sure to gain valuable insights and knowledge on this important topic.
Facial palsy. Road to recovery.
Welcome, Dr. Ivana, and thank you for joining us today.
Hi, Veronica. Thank you for having me once more. Today, I'm thrilled to talk about the subject of ear pain because I'm deeply involved in otology and I'm working with patients with ear pain on a daily basis.
It's good to hear. But before we begin, I would like to mention that this podcast is supported by FaceRehab, mobile application that allows users to scan facial asymmetry, track progress, provide interactive exercise and training plan. Download the app or visit FaceRehab.com for more information. Let's start by understanding the connection between facial palsy and ear pain. Can you explain this relationship?
Certainly. Facial palsy can cause ear pain due to involvement of nerves and muscles in the ear region. The facial nerve, which is affected in facial palsy, also has a role in some of the functions of the ear, such as the perception of the taste and the movement of the small muscles in the ear. When this nerve is inflamed or damaged, it can lead to pain in the ear.
That sounds painful. Could you elaborate on how facial palsy impacts the muscles and nerves in the ear area and what symptoms can arise as a result?
Great question, Veronica. As I mentioned earlier, facial palsy can cause ear pain due to involvement of nerves and muscles in the ear region. Let's dive a bit deeper in some of the common causes of ear pain in patients with facial palsy. One of the primary causes of ear pain in facial palsy is related to the dysfunction of the stapedius muscle. This is a small muscle in the ear. The stapedius muscle is innervated by the facial nerve, and it's responsible for controlling the sensitivity of the ear to loud sounds. In facial palsy, this muscle may not function properly, leading to hypersensitivity to sound or even hyperacusis, which is a condition in which normal sounds become intolerably loud. This can result in ear pain, discomfort, or even dizziness. Another cause of ear pain is the increase in pressure in the middle ear due to loss of the normal drainage of fluid. The facial nerve plays a role in the drainage of fluid from the middle ear, and when this nerve is damaged, it can lead to buildup of fluid and pressure, which can result in ear pain. There can also be inflammation of the ear canal or middle ear, which can result in pain or discomfort. In addition, other symptoms associated with facial palsy can include tinnitus, which means ringing in the ear, hearing loss, dizziness, or vertigo. The symptoms can vary in severity depending on the individual case, and it's important to mention that not all patients with facial palsy will experience this ear pain or these other symptoms.
It's interesting to learn that not every patient with facial palsy experiences ear pain. However, for those who do, how can they differentiate between these various causes of ear pain and know when it's time to consult with a doctor?
So, we can differentiate between the various causes based on specific symptoms, what I already mentioned. For example, infections may present with discharge, redness, or swelling, while, for example, temporomandibular joint issues may cause jaw pain or difficulty chewing. Patients should consult a doctor if the ear pain is persistent, severe, or accompanied by other symptoms, such as fever, dizziness, or hearing loss.
Okay. If I were to consult with a doctor about my ear pain, can you walk me through the diagnostic process for identifying the causes? What does a clinical examination involve, and what tests or procedures might be necessary to reach a diagnosis?
As you already know, clinical examination is the basis of the diagnosis for facial palsy. It helps determine the extent and severity of nerve damage, as well as any other accompanying symptoms. The diagnosis of ear pain in facial palsy patients begins with a thorough medical history and physical examination. Some important criteria include eyelid closure, involvement of the stapedius muscle, tear and saliva secretion, and taste. It's important to note that incomplete eyelid closure and reduced tear production can carry the risk of corneal ulceration. Otoscopy must always be performed during the initial examination to rule out herpes blisters in the ear canal. Standardized photo and video documentation is also used for tracking progress. The doctor may also perform tests, such as audiometry, to assess hearing, or imaging studies like CT or MRI scans to evaluate the facial nerve and surrounding structures.
So many diagnostic methods. How is ear pain in facial palsy patients typically treated? And what are some of the potential complications or side effects of these treatments?
The treatment of ear pain in facial palsy patients depends on the underlying cause. For inflammation of the facial nerve, corticosteroids may be prescribed to reduce swelling and inflammation. If an infection is present, antibiotics or antifungal medications may be necessary. Pain medications, including over-the-counter NSAIDs or prescription analgesics, can be used to manage pain. Potential side effects of these treatments can include gastrointestinal issues, dizziness, or allergic reactions, so it's important to monitor patients closely.
Thank you for describing that. What advice would you give to patients with facial palsy who are experiencing ear pain, and how can they manage these symptoms on a day-to-day basis?
Firstly, it's crucial for patients to consult their healthcare provider to determine the cause of ear pain and receive appropriate treatment. To manage ear pain, patients can try applying a warm or cold compress, practicing relaxation techniques, or using over-the-counter pain relievers as directed by their healthcare provider. It's also important for patients to follow their treatment plan and attend regular follow-up appointments.
Again, I would like to repeat that it's important to consult with a specialist. Are there any new or emerging treatments that you are excited about and you can tell us more?
Yeah, there are ongoing research and development of new therapies targeting the underlying causes of facial palsy and associated symptoms like ear pain. For instance, advances in nerve regeneration and neuromodulation techniques could help reduce inflammation and improve nerve function in the future. While these treatments are still in the experimental stages, they show promise for improving the management of ear pain in patients with facial palsy.
Interesting. From your experience working with patients with facial palsy, what are some of the concerns or questions they may have about the ear pain, and how do you address these concerns?
Patients often express concerns about the severity and duration of the ear pain, as well as how it may impact their daily life. It's important to reassure patients that there are treatments available to help manage ear pain and to encourage them to follow their treatment plan. Providing information on self-care techniques, such as using warm or cold compresses and practicing relaxation techniques, can also be helpful.
Thank you for sharing that. And thank you so much for valuable advices and for sharing all this expertise and experiences with us, Dr. Ivana. It's been such an insightful conversation. And to our listeners, thank you for tuning in today.
Thank you, Veronica. I like to share my appreciation as well. And I'm always eager to help increase awareness and offer assistance to those dealing with facial palsy.
FaceRehab. Bring your smile back.
Thank you for tuning in to FaceRehab, the facial palsy road to recovery. Remember, if you or a loved one are experiencing ear pain or other symptoms related to facial palsy, don't hesitate to seek medical attention. If you enjoyed today's episode, please subscribe to our podcast and leave us a review on your favorite podcast platform. We also invite you to join the Bell's Palsy and Facial Paralysis Support Group by FaceRehab on Facebook, where you can connect with others who are living with facial palsy and share your experiences. Once again, thank you for joining us. Until next time, take care of yourself and remember that you are not alone in your journey to recovery.
Facial palsy. Road to recovery.